Okay, guys, Miss Hill again, and apparently I have gotten very long-winded during this lecture for Individual Module 5.1, PowerPoint 3, because I am having to record a third lecture. Can you believe that I was like 4 slides from the very end of having this finished for you in lecture 2, and the daggone thing cut me off. So I had to cut out part of the lecture and start again here at childbirth preparation. All right, so lecture 3, and let's start talking about childbirth preparation. And I'm going to try to be quick about it so you don't have to listen to me talk for longer than you need to. So, some nursing diagnoses to consider when we're talking about childbirth preparation and educating our people on the different types of facilities that they can deliver at and different things that they need to be prepared for during labor and delivery. Think about knowledge deficit, anxiety, altered comfort, and disturbance of body image. You guys can fill in the blanks for these in terms of related to and as evidenced by, because you are at a point in this program where you should be able to do that depending on the things we're talking about. But as we're talking about childbirth preparation and the different facilities and the pros and cons of those different facilities, related to childbirth, keep these different nursing diagnoses in mind. So, let's talk about some different childbirth preparation classes and the philosophies of different childbirth methods. The Bradley method is the natural childbirth method. So in this method, the Bradley method, we have no drugs, there's no equipment, and typically we have the husband who is the coach, but it could be someone else, like a significant other, a mom, a sister, but there is a coach involved. But for your purposes, this is the natural childbirth method. So this is childbirth at its very basic. Kitzinger is the method where mom uses conscious relaxation and a progressive level of breathing to control pain and to help her throughout the delivery process. Dick Reed method takes into account the philosophy of the fear, tension, and then a pain cycle. This probably would not be my first choice. Lamaze method is one that you should be familiar with or at least have heard of. Lamaze and Bradley typically are your most popular childbirth methods if you're trying to go natural. Lamaze incorporates a partner-coached breathing method, and the woman focuses on an outside focal point to get her through the pain of contractions and through the delivery process. LeBoyer method is an infant-centered method, and this is what people consider birth without violence. They typically put themselves into a dark room. They have very low lighting, if any at all, very soft music. If you guys are old enough to remember when Tom Cruise and Katie, whatever her name is, got married, I think her name was Katie, and they had their first child, their first daughter, Suri, I think her name was, they utilized the LeBoyer method whenever they delivered. It was all part of Scientology. They were all involved in the Scientology religion, and they wanted a birth that was going to be not traumatic for their baby. So they opted to utilize this method of childbirth, and they had a very dark room, no bright lights, very soft music. I don't think people were allowed to talk during the delivery or say anything. They wanted their delivery to be not traumatic for their daughter. If I had to guess, I would probably say that she doesn't remember her childbirth, but hey, who am I? Hydrotherapy is a very popular type of childbirth method now. This is basically a water birth, and it does help actually to mitigate the pain of contractions and help the delivery process to be much easier if you choose to do it natural. Lamaze pain management methods have to do with conscious relaxation. You use very cleansing breaths to help deal with the pain. There's very conscious, controlled breathing during the Lamaze method of childbirth. Effleurage is used. Effleurage is massage. These women have to stay very focused, so they focus on particularly one point in the room. They just choose something to focus on and really concentrate on their breathing and their breathing methods. And then they use something called second stage breathing. With Lamaze, second stage breathing is breathing during the pushing stage of delivery, and there can be a consequence of hyperventilation during this second stage breathing, so we have to be really careful not to allow moms to hyperventilate during this point. Birth settings, healthcare providers, and support. So let's talk about those things quickly. Here listed are a few of the different types of birth settings. We have hospitals, obviously, birthing centers. You can deliver at home, but if you deliver at home, you have to choose a provider or an attendant for your delivery. And it's very important to prepare the other kids that might be there or want to talk about traumatizing. If you don't prepare your 9-year-old or your 6-year-old what's about to happen, this can be, I can imagine this could be a disaster in terms of trauma, emotional trauma, to other children that might be there. And then you have to think about the different types of health care providers that you might find in these birth settings. Family practice doctors, OBGYNs, certified nurse and midwives, family nurse practitioners, RNs, LPNs, CNAs. I would like for you guys to go to the website keeperofthehome.org. So KEEPEROFTHEHOME.org, keeperofthehome.org. And then I want you to search alternative birth settings and pull up the article, A Comparison of Birth Settings, Home, Hospital, and Birthing Center. And I want you to read that article just so that you have a good comparison of those different types of birth settings. Now, I also want you to consider why a provider would turn down someone who wanted to deliver in a free and alternative birth setting. And that would be something like outside of the hospital, right? So a birthing center or maybe a home birth. Think of why a provider would turn down somebody if they wanted to deliver in this type of free and alternative setting. And some reasons would be if they are high risk, right? So people maybe that have had a previous C-section, Maybe the baby is known to have some type of anomalies that put it at high risk where they're going to need specialized care. So maybe a kid with gastroschisis or a neural tube defect that has been identified. If you have a baby who has known anomalies and you know they're going to have difficulties when they deliver, we're not going to allow those people to deliver in some type of free and alternative birth settings where they're not going to have access to emergency equipment. High-risk pregnancies, so moms who have pregnancy-induced hypertension, they've been diagnosed with preeclampsia, maybe they have gestational diabetes and a very large fetus. We're not going to allow those people to deliver somewhere that's a free and alternative birth setting, or the provider typically will not, just because of the risks it poses. All right, let's go through the pros and cons of each type of birth setting. So in the hospital, it is good because we have all the necessary interventions available that we might need for an emergency. Another pro could be that you get to stay overnight. The mom gets some relief, right? The baby can go to the nursery. She has help. We have an increased opportunity to educate her about how to take care of herself and the baby once she goes home. We have a NICU available most of the time in certain facilities. So if something goes wrong with the baby and the baby needs specialized care, we have that available quickly. And typically insurance will cover the cost of the delivery. But on the flip side of that, you got to travel to the labor site while you're in pain. Bills tend to be very restrictive in terms of what laboring positions that mom can get in, the different types of visitors that can stop by, and the number that can come by at one time. They don't allow you to eat during labor. Typically allow you to even have water, only ice chips. You have very limited privacy in the hospital. We have people running in and out all the time, right? Lab, respiratory therapy, the nurses are. It's not a private setting. You have very little control as the patient in terms of kind of how things progress or how things go. You have to stay overnight, and that can be considered a disadvantage if you are the type of person who knows the deal, you know what's going on, and you're comfortable, and you just want to go home. In the hospital, another disadvantage is that you are least likely to achieve a natural birth in the hospital setting. Birthing centers. A big advantage of birthing centers are that they are very home-like. They do have medical interventions available if needed, certain types. They are typically positioned very near a hospital so that if an emergency happens, they can quickly get the mom or the baby to some advanced care if they need to. They allow more freedom than the hospital, so they allow you to get up and walk around. They allow you not to have to be connected to monitors continuously. They allow you to eat. It's less expensive than a hospital, and there's an increased chance of achieving a natural birth in a birthing center, and you have to go home the same day, or you're allowed to go home the same day. But some disadvantages could be that you've got to travel there while you're in labor. Insurance might not cover the birthing center if it's not accredited appropriately. And another disadvantage is that you have to go home the same day. So that can work both ways depending on the patient. Home birth setting. Some advantages of home birth is that you have complete privacy and control as the patient and the family. There are no restrictions. It is much lower cost. You're allowed to choose your birthing positions at your will as you want to. There are no time constraints placed on you in the laboring process and the delivery process. You are able to keep the family unit intact, and there are no side effects of drugs because they're not available in the home birth setting. But some cons are that if there is an emergency, there is a great delay in care, and that could affect the outcome for the mom and the baby. So, for example, if there is a placental abruption during the middle of the labor process, and the mom starts to hemorrhage, the outcome for her and the baby could be very bad because especially if they live far from the hospital, it takes a long time for somebody to get to them and then to get them back to the hospital, and the outcome probably will not be good. Another con is that the siblings are there, so if you want to have the freedom of a home birth but you don't want to have your kids there, that could be a problem. The insurance company will not usually pay for a home birth. Very unlikely that insurance will pay for the cost of a home birth, and that means that all of the costs of it are out of pocket. And in some states, home birth is illegal. All right, let's talk about some exercises and the benefits of that and childbirth preparation. Pelvic rock or tilt, that particular exercise prevents and reduces backache in pregnant women. Abdominal contractions improve muscle tone. If we can improve muscle tone, then we can kind of have a more strength there. It can help us with pushing during labor and helps us sort of to hold that area up because we know that's the area that expands the most during pregnancy. The Taylor sit and squat will help stretch muscles of the inner thigh and the perineal muscles. If we can stretch those muscles out, moms can get in a better position for vaginal delivery. And if we can stretch the perineal muscles, then there is a less likely of a chance that moms will have lacerations or tears in the perineum when they deliver. Kegel exercises. These exercises are ones in which a woman can sort of tighten up those perineal muscles. That they help improve sexual response in terms of orgasms, and they improve bladder tone, and they also help with perineal healing after delivery. So it really helps to strengthen the perineum in a lady, and especially after you have carried so much weight on that perineum for the past 9 months. I mean, remember how much weight we talked about that a woman gains. And all of that weight is sitting on her pelvic floor muscles. So if we can do Kegel exercises and strengthen those muscles up, then moms will typically have enough perineal tone to prevent peeing on themselves when they laugh and sneeze, right? So stress incontinence. It helps with a whole array of things. Breathing techniques. If moms can practice their breathing techniques, it will help with labor pain. And if she practices those ahead of time, then she knows how to do them, and she can most of the time control her labor pains if she wants to do labor naturally, or even control them to the point where she can finally get an epidural. And yoga also can help in terms of balance and improve muscle tone and strength as well. But during pregnancy, yoga positions are limited, so you kind of have to modify those exercises. Childbirth classes and timeline. In the first trimester, we really want to teach moms about the physical and emotional changes that happen with their body. We want to talk to them about fetal growth, nutrition and how to care for themselves. We want to talk to them about drug and alcohol use and what is not appropriate. And then whenever we talk about drug use, we want to make sure we touch on over-the-counter drugs that are appropriate and not. Exercise is important to teach in the first trimester. We don't want moms to be going out and trying to set up American Ninja Warrior in the backyard because she wants to strengthen herself for pregnancy, especially if she is the mom who can't even walk a mile without getting short of breath, right? It's important that people try to pace themselves and do the appropriate type and amount of exercise according to where they are already. We want to teach moms about the discomforts of early pregnancy also. So, backaches can be common later on in pregnancy, and we want to teach them about those things early. Braxton Hicks contractions usually start happening around 28 weeks. We want them to know these things early on in pregnancy and continually educate them about those things. But some things that happen during the first trimester that could be a discomfort are things like urinary frequency. And it's important that they know that those things are normal. In the second trimester, we want to start teaching them about the dangers of pregnancy, other types of mid-discomforts of pregnancy, like the backaches, complications that can happen. We want to continue to teach them about self-care and their lifestyle. And then in the second trimester, people can start childbirth classes. Typically, people wait until the third trimester, but the second trimester also is a good time. Now, in the third trimester, we got to start getting them prepped for actual labor and delivery. So we want to teach them about the process of what goes on during labor, the different types of pain management that are available to them. We want to talk with them about how to care for the newborn, how to feed the newborn, and get them thinking about how they want to feed their newborn. Are they going to be a breastfeeder or are they going to bottle feed? We want to teach them about the importance of breastfeeding at this point. If we can educate early, then typically we will have better outcomes. We want to teach them about fetal well-being assessments. So here's where we talk to them about fetal movement and what fetal movement means, how important it is for them to assess that on a daily basis and get a good feeling for what is normal for their baby. And then we want to teach them about postpartum care. Remember, if you deliver vaginally, you only stay in the hospital for 24 hours. If you have a C-section, that's a major abdominal surgery, and you only stay for 48 hours. So we really want to start teaching them about how to care for themselves in the postpartum period early on in the third trimester so that they have that knowledge when they deliver. Remember, going in and having a baby is a whirlwind of a process, especially if you are a new mother for the first time. It's a lot of information to take in, so the earlier we can start teaching people, the better the outcome will be and the more prepared they will be whenever they go home. Alternatives to drugs for pain management that we want to talk about. All right, effleurage. Effleurage is massage, basically. It is light pressure that is applied over a large area. It helps to promote relaxation, and it controls and alleviates pain. And it's used, remember we saw that in Lamaze. It's used oftentimes in the Lamaze method of childbirth. Cutaneous stimulation is whenever we try to stimulate large peripheral nerves, and whenever we can do that, small nerve fibers seem not to be able to pick up impulses as well. So if we can do some cutaneous stimulation and stimulate a large area of peripheral nerves, then their small ones tend to not be able to pick up pain impulses quite as good. So our body will perceive those large peripheral nerve stimulation quicker than they will those small nerve fibers. So for example, if you are doing some cutaneous stimulation on the back or on the belly, then our brain is going to pick up that feeling before it will pick up the pain of, let's say, a contraction maybe. Or the contraction will not seem as intensified if you're using cutaneous stimulation. And the same sort of concept goes with the effleurage as well. Distraction is an alternative to pain management. Controlled breathing, hydrotherapy again, aromatherapy is another one, and then comfort aids and different types of supplies that we can use. We have special pillows and special positioning devices. We have labor balls, all kinds of different things that we use during labor and delivery to help mitigate pain for those individuals who opt out of drug therapy. And that is the end of Individual Module 5.1, PowerPoint 3, Lecture 3. Thanks for listening.